So, hello everyone. My name is Arlene Brun from Torlac State University College of Nursing, BSN2B. So, for today, I will be performing the urinalysis using the acetic acid and also urinalysis using the Benedict solution. So, for the description, urine acetic acid is a test that detects if there is a presence of albumin in the proteins albumin proteins in the urine, and then to detect if there is a presence of albumin in a sample urine that may indicate the PIH or the pregnancy-induced hypertensions or in a pregnant woman, and then urine test using the Benedict solution rather to detect if there is a presence of glucose in the urine, and then if glucose found in the urine, it may indicate the diabetes mellitus, and then the purpose of this is to detect if there is a presence of glucose in the urine. And then for the materials is we need to prepare the test tube, the 10% acetic acid Benedict solution, the droppers, the test tube holder, the urine specimen, and also the match. And then the alcohol lump. And then for the assessment is we need to assess if there is we need to assess the collected urine specimen is taken before the meal and the midst flow for more accurate result, and then make sure that the urine specimen is labeled that indicate the patient name, the patient identification number, the patient age, the date and time of the collections, and also the physician name. And then for the planning is we need to prepare the place and also the materials needed for the procedure that we will render. And then for the planning or for the implementation rather is we need to introduce yourself to the patients, verify the patients, and explain what you're going to do, why it is necessary, and how the patients can cooperate to you. Assuming that I have a patients here, so magandang umaga ma'am. Ako po ang magiging nurse niyo po for today. I'm Arlene Brun po. May I know your name po ma'am? Pantingin po ng wristband niyo po. Okay po ma'am. So for today po ma'am is itetest po natin yung ihi niyo or yung urine niyo po. Tingnan po natin if there is a presence of albumin protein sa urine niyo po, and also to detect din po if there is a presence of glucose sa urine po ninyo. Okay lang po ba yun ma'am? Para pakita po natin kung may diabetes mellitus po kayo or may PIH or the pregnancy-induced hypertension po. Okay po ba yun, ma'am? Okay po, ma'am. And then after that is we need to place the paper lining on the clean and flat surface. So I have here the paper lining, assuming that it would cover the table. And then after that is place the plastic lining on the top of the paper lining. Place the plastic lining, assuming that it would cover the table also, and then put the CHN bag, and then tacking the handles of the bag beneath the bag. And then after that is open the bag and then take out the soap apron and the towel. And then after that is we need to perform the hand washing. So assuming that I've already done washing my hand, then I will dry it. And then after that is I'm going to put my apron. So first is you need to tie here. And then assuming that I've already tied it here. And then the second one is and then after that is I'm going to wear my gloves. First is I need to perform a hand hygiene again to remove all the microorganisms. And then after that is I'm going to put it here, and then I will take out the kidney basin and also the cotton balls with alcohol. So I will put it here, the cotton balls with alcohol. Then after that is take out the droppers and put it on the kidney basin and also the test tube clamp. And then the acetic acid, 10% acetic acid, the Benedict solution. The make sure that the urine specimen is separated on the CHN bag. And then I have here the, assuming that this is a match. And then alcohol lump, so assuming that this is the alcohol lump. And then I have here the waste receptacle. And then after that is we need to light the lump. And then after that is fill the test tube about 2/3 of urine. And then place the assuming that this is a droppers, then I will put it on the waste receptacle. And then I'm going to hit the upper portion of the test tube, and then make sure the mouth of the test tube is away from the patients and also to the examiner. And then after that is we need to add a 5 drops of 10% acetic acid using the droppers. And then place the droppers on the waste receptacles. And then after that is hit it again. And then after that is note if there is a changes in color. So there is no changes, it is negative, which means no turbidity. And then if it is faint turbidity, it is positive 1. And then if it is moderate turbidity, it is positive 2. And then if it is heavy turbidity, it is positive 3. And then if it is solid, it is positive 4. And then after that is place it on the waste receptacle. After that is we need to place a 6 to 8 drops of urine in the test tube. Then put it on the waste receptacles or the near on the waste receptacles. And then after that is we need to add 3 to 5 ml of Benedict solution using a dropper. Assuming that this is a 3 to 5 ml of Benedict solution. And then place it near on the waste receptacles. And then after that is we need to hold the test tube and passing it to the plane. And then after that is we need to boil it for about 2 minutes and stand for 1 minute. And then after that is we need to put the flame up. And then we need to observe for the changes in color. So there is no changes. It is a clean blue negative. So if it is bluish green, it is 0.5% sugar. And then if it is yellowish green, it is 1% of sugar. And then if it is orange, it is a 1.5% sugar. And then if it is bricks red, it is a 2% or more sugar. Then I will put it on the waste receptacles. And then after that is I'm going to wash and drain all the materials used and then discard it on the waste receptacles. So I will going to remove my gloves. And then I'm going to wash my hands. So assuming that I've already done washing my hand, so I'm going to perform a hand hygiene or alcohol to remove all the microorganisms. And then after that is I'm going to return all the equipment that I use. So assuming that I already put the alcohol lamp on my CHN bag, then I will put my gloves on the waste receptacle. And then after that is I'm going to remove my apron away from the body. So first is I'm going to remove from my neck. And then second one from my thigh, from my hips. I will untie it. Then I will fold it like this. Then I will put it on my CHN bag. And then I'm going to fold my plastic lining and place it on my bag, on my CHN bag. Assuming that it will fit on my CHN bag. And then close the bag. And then after that is we need to document all the test results. So I'm going to document it. And then after that, for the evaluation is we need to ensure that you educate your client about the results and also to the procedures. So, ma'am, all goods naman po tayo. Wala naman po tayong nakitang presence of albumin sa proteins in the urine and also presence of glucose in the urine po. Wala po tayong nakitang any kinds of problem po. Yes po, ma'am. Yes po, ma'am. Thank you po, ma'am. And that would be all. Thank you.